took a job at an adult care center, providing day support to elderly and special needs adults. I did that for about 4 years. Really enjoyed working with those patients directly, and I think that's where I found my passion for direct patient care, and then transitioned to PA school after that. My name is Brittany Butler. I'm a physician assistant at Tri-Area Community Health Center. I am from Bedford, Virginia. I did all my schooling there, and I graduated from Liberty High School. I think the most important classes I took were my science classes, but I would encourage a variety of classes, so English, math, the most important probably being biology, anatomy, physiology. Right after graduating from high school, I went to the College of William and Mary for my undergraduate, and I have a 4-year degree in biology. I went to PA school at the Jefferson College of Health Sciences in Roanoke. It is now known as the Radford University Carilion PA program. The PA program is a graduate level program. It is approximately 28 months long. There's some variability from program to program, and it does require an undergraduate degree prior to. All programs are going to require biology, chemistry, anatomy, physiology. However, I would also encourage a variety of classes. Many of my classmates who did very, very well were English majors, they were government majors, they were psychology majors, and I think that variety combined with a strong course load in the sciences did very well for them. So don't feel locked in. PA school is structured on what's known as a medical model, so it's modeled after medical school in terms of how the coursework and clinical preparation is laid out. I spent the first 12 to 14 months in didactic, which means I spent the first half of the program in the classroom. That was Monday through Friday, 8 to 5, an intensive, again, anatomy, physiology, medicine classes, and then the second half you transition to 12 months of clinical rotations, and each month is spent in a different area of medicine, so family practice, psychology, pediatrics, orthopedics, to develop those clinical skills that you'll need as a PA. PA school in and of itself does not require a specific specialty or choice. We are generally trained in all areas of medicine, and so we do not choose a subspecialty initially. However, after graduation, you will find PAs working in a wide variety of fields, from family medicine like I do, or very specific specialties like radiology, oncology, orthopedics, psychiatry, but that specialization would come after graduation. Very subtle differences. We sort of end in the same place in terms of our ability to see patients, assess patients, provide medical care, but the model of our schooling is different. The PA is modeled off a medical school model. The PA profession was founded in the 1970s by physicians at Duke University, and so that model is there. Nurse practitioners are trained in a nursing model, and so oftentimes their training is initiated as nursing. Yes, PAs can prescribe medications, and we can also prescribe controlled medications. We can interpret lab values, we can interpret X-ray imaging. The biggest difference between a PA and a doctor is level of training, right? We talked about PA program is an intense 28-month program. And then after graduation, we practice in collaboration with or under the supervision of a medical doctor. And so versus a medical doctor will have, med school is about 4 years, and then an additional anywhere from 3 to 7 year residency programs for very specialized training. I think that collaborative arrangement between PAs and MDs allows for a PA to have lots of on-the-job training even after graduation in collaboration with a physician. On a day-to-day basis, when a patient comes to me, they're coming to the clinic. So when they first arrive, my nurse is going to room them, maybe check their vitals, their blood pressure, ask them why they're here to see me. And a majority of my time is spent having a conversation with a patient about their concerns, asking them questions, getting to know them, what type of symptoms are they having. And then based on that information, I might order lab testing, I might order an x-ray imaging, I might send them to a specialist to try to help them figure out what's going on. But lots of direct one-on-one time with patients. I think the crux of being a PA is, for me, that passion is spending time with people and feeling comfortable interacting with people, both physically touching them and having a conversation with them. Probably some of my best learning experiences, whether it was in high school or through college, was working as an EMT. So something you can do in high school is even take a basic EMT course. You're going to get hands-on learning and experience taking care of a patient, working maybe as a CNA or as assisting patients in that way.